Methotrexate for the prevention and treatment of proliferative vitreoretinopathy in Rhegmatogenous retinal detachment, a systematic review. Hello, my name is Michael Balas, and I'm excited to share some of the great research our team has been working on. I have no relevant financial relationships with commercial interests relevant to the subject matter of this presentation. Let's first dive right into some background. Proliferative vitreoretinopathy, or PVR, is a severe complication of Rhegmatogenous retinal detachment, or RRD, repair. It is characterized by ectopic fibrocellular proliferation that grows on the surface of, within, and underneath the retina and is associated with poor visual outcomes. The aim of our systematic review is to evaluate the role of methotrexate as an adjunctive agent for the prevention and treatment of PVR in RRD. Articles investigating the use of methotrexate in at least 5 patients with RRD and PVR, or high risk of PVR, were identified via a literature search of Ovid Medline, Embase, and the Cochrane Controlled Register of Trials. The risk of bias in non-randomized studies of interventions, or Robbins I tool, and grading of recommendations, assessment, development, and evaluation, or GRADE, system were used to appraise included studies. Results were reported using descriptive statistics. Moving on to the results of our review, 5 studies and 85 eyes were included. The highest number of total methotrexate injections received was 8, with an average of 1.88 injections per patient and doses of 250 to 400 micrograms. No complications related to methotrexate administration were reported. After 16 months of follow-up, there was an 89% retinal reattachment rate and 0.79 logMAR improvement in visual acuity for patients receiving methotrexate compared to control patients that had a retinal reattachment rate of 61% and a 0.37 logMAR improvement. Intravitreal methotrexate targets many pathophysiological processes of PVR, and the current evidence shows support for this agent with higher retinal reattachment rates, improved post-operative vision, and an acceptable safety profile. Our review is the first to examine the role of adjunctive intravitreal methotrexate in the setting of PVR. However, further research with the larger controlled cohorts and standardized treatment regimens are needed to further characterize the role of intravitreal methotrexate in patients with RRD and PVR, or high risk of PVR. And that brings us to the end. Thank you so much for your interest and attention.